Okay, so today we're going to be talking about dental x-ray film, and this is on chapter 7. Some of the questions that we'll be addressing in this chapter is what is a dental x-ray film composed of and how does it work? The different types and sizes of x-ray films used in dentistry, and what are the differences between intraoral and extraoral film? So this starts out of your dental radiography textbook starting on page 63. So with regards to x-ray film, we'll be discussing dental x-ray film composition, so what it's made out of and what latent image is, or latent images, types of dental x-ray film, and how we store film and uh, keep it protected from the environment. So the purpose of this chapter is to define film composition, so what it's made out of, to detail latent image formation, to describe the different types, such as intraoral, extraoral, and duplicating film used in dental radiography, and to discuss film storage and protection. So as a dental x-ray operator, these terms will be important to know when communication is needed between yourself and the doctor regarding what types of films to take, as well as how long it will take for the image to be ready for viewing. Dental x-ray film composition and latent image. Dental x-ray film serves as a recording medium or image receptor. And an image is a picture or likeness of an object. A receptor is something that responds to a stimulus. So what is a latent image? This means that the image is stored but not yet ready for viewing. The way a latent intraoral image is formed is by placing the film to the lingual side of the teeth. So dental x-ray films are made up of 4 components. We have a film base, an adhesive layer, a film emulsion, and a protective layer. Why is the film base a necessary component of the film composition? This is important. The chemical crystals are embedded in the film base. This is what or where rather your image will be stored on. So the film base is a 0.2 millimeter thick piece of flexible polyester plastic. It provides strength and stable support for the delicate emulsion. So the base is constructed to withstand heat, moisture, and chemical change. The film is transparent and exhibits a slight blue tint that is used to emphasize contrast and enhance image quality. The adhesive layer is what attaches the emulsion to the base. So that adhesive layer covers both sides of the film base and it is applied to the film base before the emulsion is applied. A film emulsion is an even mixture or homogeneous coating with a mixture of gelatin and silver halide crystals attached to both sides of the film base. Gelatin is used to suspend and disperse all of the microscopic silver halide crystals over the film base, and halide crystals are the silver halide crystals are what absorb radiation during exposure and store the energy. The reason why there are 2 emulsion layers on an intraoral film is this allows an image to be produced using less radiation. A halide is a chemical compound that is sensitive to radiation or light. A protective layer is a thin coating over the emulsion to protect the emulsion from damage. So it protects the emulsion surface from manipulation, during which times we're going to process the image. So when we're taking the film out of the package and handling it kind of rough, this is what protects it from damage. A latent image formation is when silver halide crystals contain various levels of stored energy depending on the density of the objects and the area exposed. The stored energy forms a pattern known as a latent image. The latent image cannot be seen until chemical processing to produce a visible image. And the halide in the dental x-ray films is mostly silver bromide. It's the silver halide crystals, or it's this silver halide type of silver halide crystals where the image is stored. So how does this happen? When photons strike the emulsion, some particles, such as silver bromide crystals, which is a halide, are exposed while others are not. The density of the tissues that depend on the film will be exposed and, excuse me, it's the density of the tissues that depend on which crystals on the film will be exposed and which will not. So a denser object like the maxillary bone will allow fewer crystals on the film to be exposed in that area. So the crystals that are exposed are ionized and the silver and bromide ions are separated. Irregularities in the lattice structure of the exposed crystal sensitivity specks attract the silver atom. So an example of another type of latent image is fingerprints. If you touch an item, you'll leave fingerprints on it, even though you can't necessarily see them. The only way you can see them is once they are treated with a certain dust, then the fingerprints become visible. So the same thing happens with light information on an X-ray. Even though the image is formed once the film is exposed, if you were to take the film package apart in light, you wouldn't see anything. Okay, so we have to wait until after the film is processed to be able to see a visible image. All right, so the types of dental X-ray film that we're going to be going over are intraoral film, extraoral film, and duplicating film. So the most common type of film is going to be intraoral film. So intraoral film is placed in the mouth and used to determine the teeth and supporting structures. It's important to know that intraoral film is going to always be placed on the lingual surface of the teeth that you are trying to expose. So how do skilled dental radiographers reduce the patient's exposure to X-rays? The best way is by reducing the number of retakes. And the reason why the film needs to be protected from light is because light is a form of radiation and will expose and ruin the film. So we always want to make sure that when we're processing these films that we keep them away from light. And because our X-ray films are encapsulated in a film packet, light cannot pass through the packet, but X-rays can. And oftentimes the terms film and film packet are used interchangeably when they actually mean two different things. Okay, we have our film, and then we have our film packet, which encapsulates our film. So the intraoral film packaging is used to protect the film from light and moisture. It is usually available in plastic or cardboard boxes, and they usually come in about 100 to 150 films. The boxes are labeled with the type of film, the film speed, the film size, how many films are in each packet, and the total number of films enclosed, as well as the expiration date. Okay, so why would we think that some packets contain two films? Okay, so this is because it allows for a copy to be made in cases where a copy is needed, such as with certain insurance claims or specialty referrals. So film packets have four components, and this is what you actually see when you unwrap your film packets. You're going to see the X-ray film, which is wrapped in a paper film wrapper, which is attached to a lead foil sheet, and then the whole thing is enveloped by an outer package wrapping. So the film packets protect the film from light and moisture. X-ray film can either be one or single or two double emulsion film packets. A double emulsion film is used instead of single emulsion film because it requires less radiation exposure to produce an image. The identification dot is used for film orientation. A black protective sheet is used to cover the film and protect it from light. So the lead foil sheet is located behind the film wrapped in black protective paper. So this shields the film from backscattered or secondary radiation, which without it would create a film fog. So if you'll notice on one of the sheets of aluminum film, there's going to be like an embossed bump or raised bump pattern on one side. So what can happen is if you were to try to expose your film backwards, so instead of having the white part of the film facing the tube, you make a mistake and you put the little flat part towards the film. And most times the film will still expose because it has that double emulsion. But what will happen after you process your film, you'll notice that there's going to be that same raised bump pattern on the aluminum foil will appear on your X-ray image. So if you see something like that on your X-ray image, you know that you probably exposed your film backwards. So once again, the purpose of the foil is to protect the film from backscattered radiation. And if that wasn't there, the backscatter radiation would fog the image. Okay, so there's information that is printed on the label side of the film packet, which includes a circle or dot that corresponds with the raised identification dot on the film, the statement opposite side towards tube, the manufacturer's name, the film speed, and the number of films enclosed. So we have a soft vinyl or paper that seals the contents and protects them from light or moisture, like we talked about before. And then there's two sides of the film. There's a tube side, which has that solid white or raised bump corresponding to the identification dot on the X-ray film. And this is the side, once again, where the tube head should be during an exposure. The other side, which is the label side, is color-coded to identify between 1 and 2 film packets and according to film speed. So as noted in your book, a mint colored film will indicate a D speed or ultra speed film, and that's going to be a single film. A violet film packet will indicate F speed on a single film. Okay, and if we have a double film packet or a 2 film packet, the D speed is going to be a gray color and the F speed is going to be a tan color. So if you notice, most of the X-ray packets that we use in lab are that mint color. So that indicates they are D speed and a single or 1 film. So there are 3 types of intraoral film types. We have our periapical film, our bite wing film, and occlusal film. Our periapical film is used to examine the entire tooth and about 2 millimeters of supporting bone. So the term periapical is derived from the Greek word peri, which means around, and the Latin word apex, referring to the terminal end or the root portion or the terminal end of the tooth root. This type of film shows the tip of the root and surrounding structures as well as the crown. So when you take your periapical film, it's going to be very important that it shows at least 2 millimeters above the apex of the tooth you're taking a picture of. A bite wing film is used to examine the crowns of both maxillary and mandibular teeth on one film. It's also used for examining interproximal surface in order to detect decay interproximally of the teeth. And you can use a stick-on tabs or bite wing loops. If you're brave, if you're just learning, you'll probably be using the red XCP rings. So if you're using a bite wing tab or a bite wing loops, the bite wing film will have a wing or tab attached to the side of the tube or the tube side of the film. The bite wing films are helpful in detecting cavities in between posterior teeth once again. An occlusal film is another type of film. It's a larger film used for examination of large areas of the maxilla or mandible. The film is named occlusal because the patient occludes or bites on the entire film. So the intraoral film sizes come in 5 sizes, and they are available as a size 0, 1, 2, 3, or 4. And then we also have periapical film, bite wing film size, and occlusal film size. A type 0 is going to be used for small children. A type 1 is used for anterior teeth in adults. And type 2 standard film is used for anterior and posterior teeth in adults. So the size 2 film is typically used for both anterior and posterior views because it will give a wider image that will overlap adjacent images. This allows for areas to be represented more than once in a set of x-rays acting as a diagnostic backup. So if you have your laterals that are in the picture of your central x-rays of your central teeth, another way of saying this is if you're trying to take pictures of your central incisors and you get your lateral incisors in the view, when you go ahead and take your canines, you're also going to get your laterals and part of your centrals in that same view. Having multiple views will allow your dentist to further diagnose by having backup images to either confirm or make him question his diagnosis sometimes. But more information is always going to be better in trying to diagnose cavities. So having a diagnostic backup will reduce the need for retakes without increasing the amount of radiation exposure for your patient. A bite wing film, so we can use the following sizes for bite wing films. So once again, 0 is used for posterior teeth in small children. 1 is used for posterior teeth in children or positioned vertically to examine anterior teeth in adults. A size 2 would be a better way to vertically or to examine anterior teeth in adults because it once again captures multiple views of the same tooth to add for diagnostic backup. A size 2 is used horizontally or vertically to examine posterior teeth in adults. And size 3 shows all posterior teeth on one side of the arch. So a size 3 film, size 3 bite wing film is going to be a little bit more narrow and longer horizontally. So the idea is that it catches all the posterior teeth in one shot. So rather than taking 2 bite wings on one side, you would only take 1 bite wing on one side. This is currently not recommended because all of the contacts, as we know, cannot be opened on one film or is very difficult to do so. So bite wings are most frequently taken with the size number 2 film and a bite wing tab or a red XCP ring. An occlusal film or a size 4 is used to examine large areas of the maxilla or mandible. Occlusal films are very large and almost 4 times the size of a standard number 2 film. So talking about intraoral film speed, the speed is the amount of radiation required to produce a radiograph of standard density. It is the American National Standards Institute, or ANSI, ANSI, that classifies film speed. It's going to be determined by the size of silver halide crystals, the thickness of emulsion, the presence of special radiosensitive dyes, and a fast film requires less radiation exposure. So just to recap, the larger silver halide crystals increase film speed. However, they slightly reduce image resolution. So the current speeds available for intraoral films are D and F. There used to be an E speed film, but it is currently off the market due to how much exposure time is required to produce an image. F speed film requires about half the exposure time as D speed film. So we talked about before in the previous slide that a larger halide crystal, such as what's used in an F speed film, increases the film speed, but slightly reduces image resolution. And here we're talking about, in order to compensate for the graininess of a faster film, Kodak actually developed the T grain of silver halide. So rather than being round, these grains of silver halide are flat and oriented with the flat side facing the tube head. So the F-speed film, which is the newest and fastest film on the market today, reduces radiation exposure to the patient by about 20 to 60% compared with E-speed and D-speed films. All right, an extraoral film. What does extraoral mean? So extraoral means that it is placed outside the mouth during an exposure. And this type of film is used to examine large areas of the teeth and jaws. And there are 2 types of extraoral films that we're going to be talking about. One is a panoramic film, which is a wide view of the upper and lower jaws, and the other is a cephalometric film, And that will give us a picture of bony and soft tissues on the facial profile. So if you look at somebody from the side view, you will see their facial profile. Extraoral films are commonly used in specialty practices such as orthodontic, pediatric, or oral surgery practices. And orthodontists commonly use cephalometric films to view the relationship of the jaw to the skull. Pediatric dentists use panoramic films to see developing teeth because it is difficult for a child to sit through a full mouth series of radiographs. And it is also exposes the child to less radiation than a full mouth series. So once you get the chance to take a picture on a small child, you will realize how small their window of attention span can be. And a lot of times they're not very cooperative. So trying to take a full mouth series, which is 18 x-rays on a small child, is nearly impossible. So this is why we take panoramic films with small children, is because it allows the dentist to see the developmental or the development of their teeth without having to see multiple x-ray images. So extraoral film packaging. Extraoral film is boxed in quantities of about 50 to 100 films, and they are not enclosed in moisture-proof packs like our intraoral films are. Okay, so they are about 5 by 7 inches or 8 by 10 inch size. And our panoramic films are about 5 by 12 inches or 6 by 12 inch size. And since they are not enclosed in moisture-proof film packs, extraoral films should be stored in a dark room. They also should be opened in a dark room. This will prevent them from being accidentally opened in a light room, which can expose and ruin all of the films in the box. So it is advisable to seal an open box with a rubber band just to ensure that the cover doesn't accidentally fall off and ruin the box of films. So there are two types of extraoral films. We have our screen film and non-screen film. Although most of the types of films that you'll be dealing with or learning about is going to be extraoral films. Extraoral films, which are going to be your screen films. So your screen films require the use of a screen and a cassette with phosphors for exposure. So these films are also sensitive to white light, as it contains every color of light in the visible spectrum. Some screen films are sensitive to blue light and some are sensitive to green light. It's important to know that the film screen combinations must match. So if you have a blue screen film, it must be paired with screens that produce blue light. Non-screen film does not require the use of a screen, and it is exposed directly to X-rays. These are not recommended for dental use, and we will not be using any non-screen films. The emulsion is sensitive to direct X-ray exposure rather than to fluorescent light. So this type of film does require more exposure time than a screen film, and this is why it's not recommended for use in dental radiography. So extraoral film equipment. Screen films are used with intensifying screens and cassettes. An intensifying screen is a device that transfers X-ray energy into visible light. The visible light then exposes the screen film. This lowers the radiation dose to that patient. There is also a slight loss of image detail as a result of the intensified X-ray beam because the light produces a halo effect on the edge of the image film. This loss of detail makes panoramic X-rays unsuitable for caries diagnosis. For this reason, pediatric dentists take bite wings in conjunction with panoramic X-rays to make a pediatric full set. So even though we take a panoramic X-ray on a pediatric patient, because of this halo effect that's delivered by the intensifying screen, it's not going to be quality or good quality enough to be diagnosable, like a diagnostic image. So even though we take a panoramic and we don't take a full mouth set, more than likely you'll take bite wings in conjunction with the panoramic for a pediatric patient. There are two types of intensifying screen. There is a calcium tungstate screen and a rare earth screen. So calcium tungsten screens have phosphors that emit blue light, while calcium tungsten screens are are green sensitive. So they emit green light. These rare earth screens require less radiation than calcium tungsten screens. A cassette is used to hold a film and the intensifying screen. So it may be flexible or rigid. Most are rigid, except for the panoramic cassettes, which may be flexible because they have to kind of bend in a circular shape to fit on the panoramic X-ray machine. Cassettes must be light tight, so they cannot let any light seep through, and they must hold the intensifying screen in contact with the film. Otherwise, the lack of the contact between the film and the cassette will give you an image that lacks sharpness in that area. Okay, so a rigid cassette has a plastic front cover to allow the photons to pass through light. And the back cover is metal, and this is going to reduce scatter radiation. So although there is no identification dot on an extraoral film, like on an intraoral film, the cassette is marked with an L and an R for orientation. Duplicating film is a type of film used to make copies. So they are different from the type of film that you'll use to take the actual X-rays. So the longer that it's exposed, the lighter the film will be. This is different than an intraoral film, where the longer the light is exposed, the darker the film will be. So duplicating film is good if you, let's say you don't have multi-film packets during X-ray exposure, or you didn't realize that you needed duplicates after the fact. You can use duplicating film when processing your film. So it has an emulsion on one side only. It is not exposed to X-rays, and it must be used with a film duplicator. So if you don't have dual films in your film packet and you realize that you needed actual duplicates, let's say for insurance referrals, or if you're going to be referring the patient to an outside specialist, duplicating films are good to be able to copy your X-rays without having to go and take another film. So the packaging is available in periapical sizes and 5x12 inch, as well as 8x10 inch sheets. They typically come in a box of 50, 100, or 150 sheets. So how does duplicating film differ from the standard intraoral film? Unlike intraoral film, duplicating film has a single emulsion layer and is never exposed to X-rays, only light. All right, so film storage. So film is negatively affected by heat and humidity and radiation. Okay, so we want to be able to keep these things away from the film, otherwise it will overexpose or damage your film before you even get a chance to use them on your patient. So film should be kept in a cool, dry place. An ideal temperature for film storage are anywhere between 50 and 70 degrees Fahrenheit. Also, the film has an expiration date, and all film must be used before its expiration date. This is everything I have for dental X-ray film. Thanks for listening.